Hi again. I'm Dr. Mark Poray, a chiropractor in Whitby, Ontario, and I have been in practice for 30 years, specializing in family chiropractic and sports medicine. Over the 30 years, I have seen a lot of negative and untrue information about chiropractic treatment passed along to patients from allopathic physicians who don't have all the facts, from well-meaning friends who are happy to pass along hearsay, and even though they have never been to a chiropractor themselves, or from some media sources who are happy to create controversy based on semi-factual information and outright lies. There's some very unhappy history between the medical profession and the chiropractic profession. In fact, back in the 1960s, the AMA, the American Medical Association, made a concerted effort to contain and eliminate chiropractic by preventing doctors from referring their patients to chiropractors or even from accepting referrals from them. They prevented chiropractors from obtaining access to hospital diagnostic and radiology services. They prevented joint research or interprofessional cooperation and told its membership, medical students, and insurance companies and the general public that chiropractic was an unscientific cult. In 1975, 5 American chiropractors filed a lawsuit against the AMA and 20 other medical specialty groups, stating that these groups had violated antitrust laws in an effort to destroy a competitor, and that they were showing the AMA was motivated strictly by economic concerns. Now, after 15 years of litigation, the court found the AMA guilty of concealing evidence and doctoring documents. Even after the court enforced reversal of the AMA's policies, small splinter groups were formed with the intention of labeling chiropractic as a quackish cult by sowing doubt about chiropractic education and to mislead the public into believing that chiropractors think all diseases are caused by subluxations. There are still just enough of these splinter groups left whose sole intention is to suggest that only allopathic medicine is well supported by scientific research and only allopathic medicine has the welfare of the public at heart. What they fail to point out is that, for example, the British Journal of Medicine reckons that 50% of the treatments used in general medical practice aren't proven, and that 5% are harmful and are being used regardless of that. Furthermore, the treatments were rated as beneficial were in the area of 13%. Now, a medical researcher by the name of Dr. Lucien Leap at the Harvard Medical School of Public Health added that only 13% of medical procedures have ever been tested for appropriateness by randomized trials. He noted that adverse effects occurred in 3.7% of all hospitalization, and worse, that 13.7% of these adverse events led to death. Now, he was also quoted as saying that medicine is now a high-risk industry like aviation, but the chances of dying in an aviation accident are 1 in 2 million, while the risk of dying from a medical accident are 1 in 200. Now, I'm not certain if the medical profession is required to make statistics available to the public like this before hospitalization, but I do know that chiropractors are required by law to inform the public that the chances of a stroke or death from manipulation of the neck is 1 in 5 million. Now, we use lower numbers, but that's the actual number. A fully referenced article entitled "Death by Medicine" by Null and Associates reported the following. For Canada, you can make these statistics about 1/10 of the American number. But in the States, 2.2 million people experience adverse in-hospital prescribed drug reactions per year. 20 million unnecessary antibiotics are prescribed annually for viral infections. Now, we all know that antibiotics are for bacteria, not for viral infections. 7.5 million unnecessary medical and surgical procedures are performed annually, and 8.9 million people are exposed to unnecessary hospitalizations per year. Now, the worst statistic is that the total number of deaths per year caused by conventional medicine is 783,936. That equates to 2,147 deaths per day caused by iatrogenic causes or by conventional medicine. Now, chiropractic is not without its own problems, let's face it. But let's talk about the real information regarding the safety of chiropractic treatment. As long ago as 1993, Dr. Pran Magna of the University of Ottawa was hired by the provincial government in Ontario and published the following information. Essentially, it stated that chiropractors should be the treatment of choice for low back pain. It excluded traditional medical care altogether as a treatment choice. Specifically, there is an overwhelming body of evidence that indicated that chiropractic management of low back pain is more cost-effective than medical management, that many medical therapies are of questionable validity or are clearly inadequate. There is no clinical or case-controlled study that demonstrates or even implies that chiropractic spinal manipulation is unsafe in the treatment of low back pain. There would be highly significant cost savings if more management of low back pain was transferred from medical physicians to chiropractic physicians. There's also good empirical evidence that patients are very satisfied with chiropractic management of low back pain and considerably less satisfied with allopathic management. So the specific recommendations were that chiropractors should be fully integrated into OHIP. 2, chiropractic should be, because of the high incidence of and cost of low back pain, hospitals, managed healthcare groups, community health centers, comprehensive health organizations, and long-term care facilities should employ chiropractors on a full-time and or part-time basis. A good case could be made for making chiropractors as the gatekeepers for all musculo-skeletal complaints that present to hospitals. Interestingly, chiropractic was fully integrated into the OHIP system following the Magna report, but in the last 10 years, in a short-sighted move that ignored these results, chiropractic was once again removed. Now, on the plus side, many hospitals and community health clinics are now integrating chiropractic physicians onto their staffs. Chiropractors have had their x-ray privileges restored, but lab services are still closed. So let's talk about the safety of cervical or neck adjustments. This is the controversial topic everyone loves to latch onto. Dr. Scott Haldeman, a well-known chiropractor and medical doctor, reviewed malpractice claims for a 10-year period. In reviewing more than 134.5 million neck adjustments, the record showed 23 reported cases of stroke or vertebral artery dissection. Of this group, 10 had complicating factors of high blood pressure, a history of contraceptive use, and or smoking, all of which are associated with vascular disease. The actual incidence of stroke or VAD following cervical manipulation was 1 per 5.85 million. How does that compare to 1 in 200? The average chiropractor would have to work 1,430 years before he was involved in this type of litigation. So rather than raising concerns about the safety of chiropractic, these statistics emphasize that spinal manipulation in the hands of unskilled practitioners is dangerous, and the practice should be closely regulated. The World Health Organization has clearly stated that chiropractic is a separate profession, not just a set of techniques to be used by other professions. They have indicated that a medical graduate should require an additional 1,800 hours of classes, including 1,000 hours of supervised clinical training before claiming to offer chiropractic services. So in conclusion, in a series of articles on the lack of training in musculo-skeletal disorders published by Kevin Friedman, MD, between 1998 and 2002, it seems that the department chairs of several hospital-based orthopedic residency programs designed a basic examination on musculoskeletal competency and gave it to their residents. 82% of the medical school graduates failed the exam. 4 years later, the exam was simplified, and this time 78% failed. When the same exam was given to final quarter chiropractic students, 70% of them passed. With respect to musculo-skeletal disorders, then, this difference is significant and should be noted. In fairness, no doctors can be good at everything. Neither do these facts imply that chiropractors are better than medical doctors. However, it does demonstrate the high level of training possessed by DCs in spinal manipulation, the safety and effectiveness of spinal manipulation when utilized by chiropractors, and the competency of chiropractors specifically in the area of musculo-skeletal disorders. Look, I hope you found this informative or entertaining. I'm Dr. Mark Poray, and you can see more health-related blogs as well as contact information for my office and my hours on my website at www.drporay.com. I'd be happy to treat you or your family members at my office in Brooklyn, Ontario.